Get in tune with the past at the Louisiana Renaissance Festival.
We're back at Cypress Point Hospital in Hammond, where there are a lot of exciting things happening, including the pain management work of Dr. Chad Domangue here. But first, the Christmas parade is coming up. This hospital is a major sponsor, and the mayor and others are coming by, as a matter of fact, for a presentation on that subject. And it's great to have somebody like Cypress Point so active in the community.
Yeah, growing up as a kid in Houma, the Christmas parade was definitely one that I had circled on the calendar. Getting to see Santa at the end, and hopefully my wish list would come true. So it's a very special time of year. The parade, I think, is great for the community, and we're committed. I think, as you guys know, we've been growing. We have a lot of exciting things coming. We're going to start developing the land around our hospital. When I took over this hospital about 2 years ago now, I never looked at it as a hospital in Hammond. I looked at it as an opportunity to do something on a bigger scale, which we have been doing. We're doing research, we're bringing in doctors, so we're really vested in this community, and not just for our patients' safety and medical outcomes, but advancing community, advancing commerce, and creating jobs. So it's a big part of what we do here.
Well, in the meantime, everybody's talking about pain management, frankly, because of the opioid crisis. So what do you do in your line of work to help in that cause?
Yeah, being a Louisiana guy, it's one of my favorite quotes. Guns don't kill people, people kill people. There's no doubt we have an opioid crisis on our hands. Where I did my pain fellowship in Kentucky, we wrote no narcotics. So it's a very unique fellowship. When I got here, it was kind of astounding to see what the community standard was. But I think the answer is somewhere in between. We have to do our due diligence, make sure patients are taking medicines appropriately, make sure they be given to appropriate patients. But it's frustrating for us because the government has identified a problem, and they're right for doing so. But they haven't identified a solution. And if you eliminate all the narcotics, which I think we need to decrease them significantly, people are still in pain. And the problem for us is the alternative treatments we have for pain management, sometimes the insurance companies won't approve it. And so sometimes we're in a situation where, as a pain doctor, what the government wants us to do is different than what the insurance company does.
By the way, what are some of the procedures you do here to relieve pain?
Yeah, so when you really look at the opioid epidemic, it's really talking about people with chronic pain. So they've failed surgeries, they've done everything, and they're just left with a situation where they're going to hurt forever. Two of the things that we do a lot of that are long-term options would be spinal cord stimulation and pain pumps. We are a research hub for the spinal cord stimulator company called Boston Scientific, a national research hub. And we're also a research hub for a company called Flowonics, which does pain pumps. Both of these devices allow us to control pain with a stimulator using electricity and with a pain pump using narcotics, but allows us to deliver things in a way that is safe for a patient, is a long-term outcome, and allows us not to have to use these high-dose oral opioids and so forth.
So are we talking primarily about back pain?
Everything. So as you guys know, I did research a couple years ago using stimulation for headaches. I'm still actively doing research for that. This pain pump treats everything. We have people with rheumatoid arthritis, people that have failed surgeries in their backs, their necks, people with hip, knees. So pretty much any pain that a patient has, we do have something in our toolbox that can treat it.
So you've seen advances in recent years.
So I have. It's not advanced as much as I would like. I look at my iPhone and every year how much neater that technology is. But that's occurring in medicine as well. And it's just keeping up with it, and it's getting proper patients to proper medical technology. And once again, back to the gun analogy, it's not always that a surgery or a procedure fails. Sometimes it's not the perfect one for that patient, so you have to have appropriate selection with appropriate therapy, and that sometimes can be tricky.
So what about a person out there, they hear this interview, they are in pain, or a member of their family has had chronic pain. What do they do next? How do they access what we're talking about?
Yeah, so obviously you can schedule an appointment with us online, go through the Cypress website. Cypress Point Pain Management is the name of the practice, but it's a good point, and it's a national issue. I like basketball, so I think about the point guard, and people with pain sometimes, it's kind of like a Russian roulette. You know, how do you know what doctor to go to? Is it a chiropractor? Is it a surgeon? Is it a pain doctor? And a lot of times you're just going on it based on what your primary care doctor refers you. But we have to get better, you know, and I think through technology, social media, we're advancing the ability where the average patient is now more educated to kind of find themselves the right physician that does these type of therapies, because otherwise you're kind of relying on word of mouth or a referral from a general doctor, which is, you know, not always the appropriate way to go.
But I mean, a person then would go to the website, they'd make an appointment, then what happens? They come here, they're examined?
Yeah, so, you know, we examine patients in clinic. We take a full history. We look at their records, look at the MRI, and then we try to create a game plan. So when I see patients, I don't always just talk about what we're doing today. I sit down with them, I go over the MRI, I show them a skeleton, explain the parts of their anatomy that I'm concerned about, and then we talk about what are the options. And I like to look at medicine just like anything else, is you never want to look back and regret. You know, there's never a black and white answer, and you want to put everything on the table for a patient and describe the good and the bad about everything, and have a team approach. You know, we don't have the answers for everything. We work closely with our surgeons, closely with our physical therapists, chiropractors, you name it, and try to do, you know, a treatment plan that gives a patient not just today, but an outlook in terms of 5-10 years, what type of things could be coming their way.
So in other words, you look, I guess, take the long view.
Yeah, so, you know, I'm a little bit different as a pain doctor because I did neurology first, but I think one of the things we're losing in medicine is that clinical aspect, the touching, the talking, you know, creating that bond with a patient and getting them to be part of the treatment. I can do everything I want as a doctor, but if a patient's not bought in and not taking that journey with me, the outcome's never going to be great.
But you rely on other health professionals.
Yes, absolutely. And that's what we were talking about earlier, is understanding the strengths and weaknesses of all the healthcare professionals. And by identifying that and then identifying the correct diagnosis allows us to take a patient appropriately. We never keep them in a system where they're just kind of treading water. We're constantly moving them along. We're delivering that outcome where, once again, they don't look back and regret, but they never find themselves in a treatment plan where things are not moving forward. They never find themselves plateauing.
You know, if you know anybody that has been in chronic pain, and you must know hundreds, that then solve the problem, it's revolutionary in their lives.
Yeah, it's the most rewarding thing that I do. You know, I was talking to some of my friends the other day, and obviously business and running a hospital aside, the thing that I do love is taking care of people. I mean, that's why I do what I do. And sometimes we lose sight of that, you know, because I always say the given as a doctor is a good result. When you get a bad result, that's the one you focus on. But no, it is very rewarding, and it is very rewarding when I see these patients that have seen other physicians or been down a road where they haven't gotten the treatment they've needed. But yeah, I mean, look, we're trying to spread the word. We're trying to, you know, take every care of this community and grow things. But it's been very rewarding, and I've been very pleased with this community, and I've been very blessed with the people around me, the staff, the nurses, everybody.
Court's always in session at the Louisiana Renaissance Festival.